Hello, my name is Dr. Carly Haug, and this video is the second in a two-part series on generating the best case, worst case ICU graphic aid. To get the most out of this video, you will want to have access to the patient story document and a blank graphic aid. This video describes the case contained in the patient story document number 2. This exercise works best if you complete the graphic aid for this patient story before watching the video, but this video can be used on its own after briefly reading the patient story. Let's get started. Today, we are taking care of a 75-year-old male who presented as a level 1 trauma involved in a motor vehicle collision. He has severe facial fractures, including mandibular and nasal fractures that will require fixation, tracheostomy, and PEG. He was admitted to the ICU last night. We are now rounding on him the morning after his admission, and I'm filling out the graphic aid on rounds. Each column represents one day in the ICU. We are rounding on January 4th, but I want to capture that he was admitted yesterday in column 1. I write the date and that he was admitted to the ICU. On the day we are rounding, or January 4th, I write breathing tube placed and broken bones in face, because those were the major events from yesterday. I'm placing the star in the middle of the line because there's a fair amount of uncertainty here. He is older and has multiple medical problems, but his injuries seem isolated and his story could go either way. Next, I write a few notes around the star about what it will look like if things go as best we are hoping. He will need surgery for his jaw, trach, and PEG. We hope he can get off the vent in 2 to 3 days, and he'll have a trach and PEG for about 2 months. He'll likely be in the ICU for a few more days and in the hospital for 1 to 2 weeks. He will need rehab or a skilled nursing facility for 6 to 8 weeks. As a teaching point, it's important to note what the scope of recovery might entail, that he can't go right home after this hospitalization because of the trach, PEG, and need for ongoing rehab. He'll need support at a rehab or nursing facility prior to going home to build up his strength. If things go as best we might hope for, we think he will return home eventually. He may walk and talk a bit slower, but we expect in the best case scenario, he will be mostly like he was before. For the worst case, we worry that complications add up, he loses independence, and requires a nursing home or assisted living for the rest of his life. For now, I indicate the worst cases, complications, and loss of independence. Given his age, we might worry that unforeseen complications could add up and he could die. But given what we know now, death isn't really plausible. He has isolated, treatable injuries. If in the future he developed a complication where the outcome of death seemed more plausible, we would then change the worst case to something like, we worry he could die. As a teaching point, to support the patient and their family members, it is important to use the language I'm hoping for or I'm worried about when talking about what is on the graphic aid. The following day on rounds, we note that yesterday was pretty eventful as he had a stroke in the afternoon. So I write stroke as the event. I then move his star lower. Using what you know about this new event, consider your judgment about this new event. At times we have information that this is not so bad or this is potentially devastating. For this patient, his stroke appears to be pretty minor as his neurodeficits are already improving and his repeat head CT was stable. I write a few notes around the star about what it will look like if things go as best we're hoping. He will have jaw surgery tomorrow. He may need the ventilator longer because of the stroke. He'll need a longer time in a SNF to recover. We estimate 8 to 12 weeks. Hopefully he can return home. He will need close support to eventually do activities of daily living independently and be mostly like he was before, but may move slower due to the stroke. His worst case still includes loss of independence, particularly if this stroke is more serious than it appears right now. So I draw an arrow over. As a teaching point, when I place this star, I leave some room for the star to move further down the line in case he deteriorates more. If this were a bigger stroke based on exam or radiographic findings, I would put the star lower. If his scans or clinical exam improve, you can move the star back up. The next day, we note he had no significant events, so I write a 0 for the event and place the star in the same position. His fever overnight was not associated with other major findings, such as hemodynamic instability or leukocytosis. As such, it does not change his overall story, so I do not write it as an event. On the morning of 1/7, he again had no events the day before or overnight. I write a 0 for the event and place the star in the same position. You do not have to spend time rewriting details if the best case is the same as the day before. Rounding the next day, we note his significant event to be surgery yesterday. Since the surgery went very well, his overall story is improving and might advance his discharge from the ICU. He has perked up significantly. I place the star a little bit higher relative to where it was on the previous page. As a teaching point, this is an event because it actually improved his outcome. We have more information today. Now we know the operation went well and he got a boost from it. He's already starting to wean off the vent more quickly than we had anticipated. He also seems to have less pain and has enteral access to advance his nutrition. So this is a positive change to the overall story. Since the story is improving and there is a change, I add more detail. He'll likely need to be in the ICU for 4 to 5 more days. He can maybe get off the ventilator in 3 to 4 days now that he has a tracheostomy. He will still need rehab for several weeks to months and would likely discharge to a rehab facility. If things go really well, we have hope that he will be like he was before and could return home. Finally, for the worst case, I reiterate that we are still worried he could lose independence, in part because he could still have a complication and in part because we aren't sure how his rehab will go. On rounds the next day, I note that he had no major events. I write a 0 for the event. I place the star in roughly the same position as the day prior. The following day, we again note he had no major events. I write a 0 for the event. I place the star in roughly the same position as the day prior. I draw an arrow to continue the worst case scenario over. On day 8, or January 11th, today, he's almost ready to leave the ICU. He again had no major events overnight and is tolerating trach mask. I write, hasn't needed the vent for 2 days as the event. When a patient has many days of no change, it is helpful to pause and reflect on what is happening. For some patients, no events can portend a worse prognosis than we thought because they aren't improving as anticipated. Sometimes no events can signal the patient is improving faster than we anticipated because they haven't had any major setbacks. For this patient, I consider the accumulation of no events a positive event. Now we are more optimistic he'll do better than we thought before. You can use your judgment when you're seeing multiple days without events and consider whether this changes the overall story. With this information, it seems like he may do better than we anticipated and his hospitalization will be shorter. So I move his star higher. Next, I fill in details about what his life might look like. He's getting better slowly. We anticipate transfer out of the ICU today. We are hoping to discharge from the hospital in 5 to 7 days instead of weeks like we thought before. He will likely need months of rehab, but eventually we'll get back to things he enjoys doing like cooking, tutoring, and bird watching. We hope he will get home eventually, and we hope be able to take care of himself again. As a teaching point, while writing the best and worst case scenario, it is helpful to include details about the patient's mobility and ability to do things that they may enjoy. His worst case remains the same, so I draw an arrow over. On 1/12, our patient has left the ICU. Your team may stop rounding on him and filling out the graphic aid as his care transitions. However, maintaining the graphic aid outside of the ICU can benefit patients on the wards or even in rehab, depending on the team's ability to update it. You might consider sending the graphic aid with the patient to rehab to give the next team a better sense of how the trauma team discussed the patient's trajectory with them. You might also consider giving the graphic aid to family. They could use it to ask for updates in this format or bring it to future appointments to make sense of how things are progressing. Thank you for your time and attention to our video. Other videos pertaining to this topic can be found on our YouTube channel. Please reach out via phone or email with any questions, comments, or feedback. Thanks so much.